So most of the time you'll know you're allergic to something after you've encountered it for the first time, or you've been experiencing these symptoms that you've never knew you were allergic to that product or that thing. For example, let's say you've never eaten peanuts before, and for the first time you ate peanuts, you started experiencing these rashes and started experiencing like fever, and you feel like you want to vomit. And also, let's say for the first time that you maybe went to a friend and you carried the dog or the cat, and then you realize you are starting to sneeze and you still can't understand what is happening to you. Or maybe you ate something. Let's say you went to a friend's place and ate fish, or you ate eggs, but most of the time what we usually think is that maybe the food was rotten, or maybe it's only that it's cold and I only have a cold. And you find that most people don't really realize the difference between having a cold and having an allergy. And today I'd really like to talk about that. So what is an allergy? Hello beautiful people, welcome back to my channel. If you're new here, my name is Lois Odur. So an allergy is a response to a foreign substance, and when I say a foreign substance, I don't mean that what I'm going to mention to you that is something that you should not eat or something that you should not use, because something that might be foreign to you is not foreign to me. Maybe to you when you eat peanuts it becomes foreign to you, but that doesn't happen to me. So it is a response to a foreign material, but it is specific to different individuals. And we have varieties of allergies. It can be because of food. We have food allergies, and the ones that are mostly registered are peanuts, fish, milk, eggs. Those are the ones that I've seen like frequently. And also when it comes to pollen, like plants, there's some plants that some people are allergic to. There are also some people who are allergic to some certain animals, especially pets. And it can also be an allergy due to drugs. There are some drugs like penicillin. You find that most people are allergic to penicillin, and therefore you have to use another drug. And it can be allergic to many other factors, like even if it is dust. Like there are these people, whenever they stay in a place that is dusty, or whenever they like open old clothes, they really sneeze and they really have quite strange allergic reactions. And it can also be because of latex. Like that these people, whenever they get to the hospital and they use a certain glove like the latex one, they really get some reactions and they have rashes and they feel so itchy. Even when it comes to other things like condoms, let's say when they use a latex condom, they'll have reactions and they'll feel really itchy. So that means we have a variety of things that people can be allergic to, and it really depends on someone. And most of the time people really confuse the symptoms, and today I'd like to describe each and every symptom. I know it can be different with different things and different people, but I'd like to describe the ones which are really common. So first I'll be talking about food reactions. So most of the time you'll find that with food reactions it will really take a long time before you realize that you are allergic to that food. Because let's say it's fish. So the first time you took fish, maybe you felt like, maybe it's because it is the first time that I've taken it, that's why I'm feeling nausea and I'm having rashes. Then you take it again for the second time and you have other symptoms, like you feel like you have abdominal pain and swellings, and maybe this time around you're starting to think like maybe the food is bad or something. So most of the time it will take a while before you realize it is an allergy, because you won't be taking this food every time. You won't be taking fish every time, or let's say eggs every time, but you'll realize that the moment you use this certain type of food, maybe the moment you eat fish, that's when you develop this kind of symptoms, and that's when you realize you really need to seek for help. Next we have the seasonal one, and when it comes to the seasonal one, this is whereby people experience different symptoms with different kind of weathers, and the one that I've seen most is cold. Like most people have allergy to cold, that whenever they go to a place that is very cold, or whenever the weather changes and becomes cold, they start experiencing some symptoms like running nose, they have headache, and then they feel congestion. You see the way asthma patients react, like you feel like your chest is so congested and even have chest pain. So those are the symptoms that they have. And even when you look at them, when you look at their face, like their face seems so full and their eyes look so swollen, and their face looks so like it's swollen. Their face is swollen, the eyes is swollen, the eyes even reduce in size, and then they have running nose and they are even coughing, their chest is so congested. So that is for those who have cold. I haven't seen so much about those who are in warmer temperatures, but for cold is the most that happens to most people that I've seen. So when you come to the cause of allergy, that most people don't really know why they're experiencing the allergy. Like the cause is not quite known. But mostly, the one that I know of is that it is mostly linked to genetic, that not that because I'm living with someone, they might be able to be allergic, the same thing I'm allergic to, but because we are genetically linked, maybe it's your child and you can pass it down to them. I've seen so many families whereby the mother is allergic, has certain kind of allergy, and all the kids, like, they have different kind of allergies. So the one that I know is that it can be passed genetically, but the real reason as to why someone develops allergy is not really quite known. When it comes to the diagnosis on as to how you can know that you're allergic to a certain thing, is that the first thing that is so vital is the history. Like, have you eaten something that you've never eaten before? Have you done something unusual that you've never did before, or gone to a place that you've never been before, or done or become into contact with something that you've never like used before? So when you get that detailed history, when you are like open with it and tell us the truth, so that we can be able to realize that what is it that is really you are really reacting to. Then after that, we can do blood test, and we also have skin test. So we do skin test with a similar substance with the one you have reacted to, and then if it reacts, then now we'll know that is what you are allergic to. So the first thing that you'll do in terms of treatment when you experience these symptoms, when you feel, let's say, the congestion when you go to a cold place, or when you feel the rashes when you eat a certain food, the first thing to do is to seek for help. Like, avoid self-medicating yourself. Seek for help and go see your doctor, so that they can be able to know what you're allergic to, and they can be able to help you so that you know what to avoid. So the first kind of treatment I'm going to tell you about, maybe this is not treatment but a preventive method so that you don't experience these symptoms, is to avoid the triggers. Like, stay away from what is triggering these symptoms. If it is a certain food, let's say if it's fish, you stay away from that food and you avoid it. So like, whenever you go to some places, someone knows that you don't take this kind of food, you don't eat food that contains this kind of thing, so you avoid that food. And even when you go to the supermarket and you're buying a certain food, you should always be checking. Like, they're usually written somewhere the ingredients. You should always check the ingredients to ensure that it doesn't have something that you're allergic to, so that you avoid food. Like, avoiding the trigger is one of the best methods to be able to avoid experiencing these symptoms. If it is a cold place, you always make sure that you keep warm. You keep warm, and you make sure that if you can avoid going to those places. If it is avoidable, you avoid. If you can't, because sometimes that is your home and there's nowhere you can go to, you just make sure you keep warm and you take care of yourself. If it is about dust, you avoid dust. You avoid dusty places. If you can, let it be that you're not the one to do the dusting in the house. Then also, you make sure that the house, like, it's like you have a good air circulation, and you have, like, if you can, you have the air filter, so that, as in, the atmosphere of the house is just free from dust, and it is nice for you, so that you don't experience these triggers. But then you find this, yes, you can avoid all these triggers, but at times it gets to a point whereby you never knew you were going to experience it. Like, let's say you went to a place and it was still like the sun was still shining, and when you got to that place, you stayed there until when it was too late and you started feeling cold, and then you started experiencing these reactions. So you find that this is something that you couldn't have avoided. Or maybe you went to a party and they cooked food, and you are all over the place, you are eating, and maybe you never even asked what was placed in the sauce, and you ate it. But these people never knew you had a reaction to peanut, and you started experiencing these symptoms. So that means that even apart from avoiding the triggers, there are other things like medications which are usually included. And when I talk about these medications, I'm saying don't go and start self-medicating yourself and going to get the over-the-counter drugs, because you're not even sure, like, if that is what you are allergic to. But just for educational means and just to inform you, for allergy, most of the time it is because when you experience these allergic reactions, you produce something we call histamine, and histamine is the one that brings about these symptoms. So that means that the drug that you should be taking should be antihistamine, that is against the histamine to bring the levels down. So we have antihistamines, and also when you experience these allergic reactions, you usually get some inflammations. That's why you'll experience like rashes and such kind of things. You get inflammations. So and that means that the other drug for inflammations is corticosteroids. So you have antihistamines and corticosteroids. The other thing that you might be given, and which I think is usually important for you to have, is an emergency epinephrine. So this is usually a shot. So you carry this shot wherever you go, so that whenever you experience these reactions, whenever you encounter these reactions, you can be able to take the shot, so that you can be able to wait until help arrives. Because at times maybe you are far away from the hospital, and maybe for these people to be able to help you to get to the hospital, it might take a while. And remember, for allergy, at times the reaction can worsen for you to get something we call anaphylactic shock. So this is when the allergy has gotten so far and it takes you to shock, if you know what shock is. Yeah, so that means you should be having something like an emergency epinephrine. So you have this shot that will help you until you get until help arrives. That is. The other thing is about the natural remedies. So you find that there are a lot of natural remedies that people will tell you about. We have different plants, we have different oils that people will be talking to you about, and they'll tell you these natural remedies. But at times you find that some of these natural remedies usually contain something that you're allergic to. So before you use any of the remedies that are given to you, make sure that you keenly check if it doesn't contain anything that you're allergic to, so that it doesn't complicate you. But something that I know about, you can use honey, and also you can take the foods that are rich in vitamin C. You know, for vitamin C, like fruits, you find vitamin C usually reduces the histamine levels. So most of the time it can complicate to other things like anaphylaxis, the one I talked about, and it can also trigger other conditions like asthma. So what I'd like to tell you is that when you're feeling like you're experiencing any of these symptoms, you first seek for help, so that you can know the real cause, the real thing that you're allergic to, before you even start self-diagnosing yourself. So I hope this video was helpful to you, and if you have any other question, you can leave it down in the comment section. And thank you so much for watching this video. Bye bye.